Hi, Sandra. Oh, you're on mute, and it says that you're me because I think I.
Oh my goodness, I'm so sorry. Oh, and it does. It says that I am Marlise. Is that you?
That's my first name. I'm a junior, so I go by my middle name Stephanie. So that's why.
Oh, how neat. What a pretty name. I've never seen
Thank
that.
you. It's my mother's name, so I go by that.
Is it
Sorry.
pronounced properly?
Yeah, you said it correctly. So yeah.
Ah, okay. I'm gonna put in, what am I putting in? Just my name and um they know that I'm Simmons, right? They know we're Simmons. We'll just say Simmons.
Yeah. So now you should be co-host. You should be able. I'm just finishing up my headshot event. I'm finishing up with our last student, but I just
Oh,
wanted to make sure that
thank
I was
you. Thank
here.
you. Well, this really, I just can now put myself on mute, wait for them to come in, and we're ready to go.
Yes. So I should be back in like a couple minutes, and I should be right back.
Perfect. Perfect.
All
Thank
right.
you.
Thank you so much, Sandy. I'll be right
Oh,
back.
thank you. Sure. Hello, Peter.
Hello.
How are you?
Good. How are you?
Good. I'm Sandra Bailly, the Associate Director of Student Support at the School of Social Work, who is a partner of Stephanie in this event. And so we're glad to have you with us. And I see a couple of people already, but Stephanie is on another, she's just wrapping up some student calls, I think, and then she is going to join us.
Okay. I've never been on one of these chats before, just to let you know. But I am a Simmons.
It's
I'm
a
a Simmons School of Social Work graduate, actually.
Who is? You
I
are?
said I graduated from Simmons a million
Oh, you
years
did. Oh, you did. Which year? I am too. My alum as well. What year?
ago. 1982.
Oh, you beat me. Okay, I'm 94. Wow.
See?
Oh, you make me feel
Someone's
good.
older.
Well, it's great to see that you're still doing this, and
Still kicking.
Yes, yeah, that's wonderful. And this is a conversation, I just, kind of have a conversation. We never know who's going to show up. Some of the students we kind of cut at that 50-minute hour just because, classes start at 6 for some. And so we just get a sense of who, we'll see who shows up. And it's just a back and forth. And then we allow, Q&A, and they can ask questions. But it's really about getting to know the org, but through you and what your career, path was in getting you there. So,
So are you staying in this chat?
Yes,
and
I will be the one.
leading it?
I will do that.
Okay, that's fine. Thank you.
I mean, if you prefer me not to, and you have something that you want to present, you can do that too.
Like I said, I've never done one of these chats before, so I'm happy with any direction that you can give me.
Okay, so we just make it a conversation then, okay? And is there someone named Wanda joining with you?
I don't think so. Wanda is the human resources recruiter, and
Okay.
I don't think she was planning on being here, just myself.
Okay, sometimes we have both, right? And so that's okay. So right, I'm the social work side, and Stephanie's the employer side. I'm the student side of how it works and the content on the social work side. So yeah, okay. Well, we have a minute before we start opening up the doors. So we have a person, I guess, in the waiting room. Who, Carolina?
Hi.
Hi, are you a student that's joining?
Yes.
Okay, wonderful. Okay, we're gonna let others in then with you.
Thank you.
Hi, Janie, Carolina. Welcome. And and people may pop in as we begin. And so right now you get a captive audience of a couple of students, and we'll get ourselves started. Let's get ourselves started now, and then as others join, they can, and as folks have to go to classes, you let us know that as well. So welcome, Peter Schindler, to Simmons School of Social Work, and in partnership with our career education centers, employer chat. Here's Stephanie, that partner in crime here, who has been behind the scenes speaking to all of the employers that come through to help support these chats. And so this is the fifth one that we've had this semester, and we do this really to allow for getting to know an organization from the inside out, right? We could send students to your website and they can find out about North Suffolk's mental health, and they can figure out benefits, et cetera, et cetera. But there's nothing like beginning a relationship with someone from within, and that's the reason why we established this, and it's so that they can get a deeper understanding of org culture, expectations around the priorities of the organization, maybe just hearing and sharing about your own career path, how you came to be, at North Suffolk, and what keeps you there, and anything that a new grad would really benefit from hearing as they make their choices in the next few months, and many may, and some we have the programming is a lot different from our time. So we're fortunate to have Peter as the director of the of the adult community service aspect of it all, right? Who is an alum as well. So we're very fortunate to have an alum in the house as well. So with that, what I'll say to you, Peter, is that the programming and who could be in the room or could come in and out, this was geared primarily for our MSW students who will be, graduate, who are on the traditional path on ground, they come to campus. However, we have a whole new arm of online students as well for the MSW program, and we through across the country, and they may join sometimes as well. And we actually have a suite of programs that from BSW on ground online, MSW on ground online, PhD online, DSW online. And so we open this up as a house of School of Social Work for anyone that may be interested in the organization to join. And as we learned last time, we could have another discipline even pop in if they got wind of it through Handshake or through our career education, and we welcome them. So we think of the roles within your organization broadly and possibilities from a social work ladder type of thing, but also from other disciplines. So with that, Sandra stops, and we welcome you, Peter, to tell us a little bit about who you are. They have a bit about your bio already that I know Stephanie sent out, but if you just tell us a little bit about who you are, where you sit in the organization, maybe about the larger structure, and then how you got there. We'd welcome it.
Okay. So we have, is it Janie or Janny?
Janie.
Janie, okay, and Carolina and Haley, right. So I'm Peter Schindler. As you just heard, I'm also a Simmons School of Social Work alumni person, but I went there probably before you were all even born. So I graduated there in 1982, and that was when the school was on Comm Avenue in a brownstone building, and I know things have changed a lot over the years. I am currently the director of what's called Adult Community Clinical Services at North Suffolk Mental Health Association. North Suffolk is a large human services agency, and I run one of many departments that it has. It happens to be the largest program at North Suffolk, but there's many different departments depending on what your interests might be that I'm sure would welcome applications from you when you're heading towards graduation. Are you all graduating in the next year or yes? I can only see one of you, so
yeah, feel free to put it in. Feel free to put your response in chat, or just pop in with your camera off if it needs to be.
Okay, at any rate, it's a good time to be looking for a job because, as I assume you know, employers like my place are very much interested in hiring people. We've had difficulties hiring people during COVID and beyond, and we're in the same place that just about every other employer is in across this Commonwealth and across the country. So we're happy to get any kind of applications we can get. Mm-hmm. So North Suffolk is an agency that its administrative office is in Chelsea. Most of the services that we provide are in the East Boston, Chelsea, Revere, and Government Center area of Boston, North End and Charlestown part of Boston. That's where the bulk of the people that my program works with live, and that's where our offices are. The program that I direct is called Adult Community Clinical Services. It's a Department of Mental Health funded program. We have a $20 million contract with the Department of Mental Health to work with adults, people 18 and over, could be 18 to literally 100 years old, people who are diagnosed with SMI, serious mental illness, and often people who have co-occurring disorders of substance use or serious medical issues or any number of other kinds of things that people have. We work with, at any given time, almost 500 clients. About 150 of them live in group homes that we manage. We have 16 group homes in the community, and the rest of the people live in the community, either in their own homes or apartments. We have many people who are also who also don't have homes, who might be living in general shelters or Department of Mental Health shelters. And all of our clients are referred by the Department of Mental Health. So if your interest is in working with people who, with adults who have serious mental illness, this is a program you might want to consider. There are other agencies across Metro Boston that offer the same service. VinFen and Bay Cove Human Services have similar programs in Metro Boston, just in different areas. Our program is basically clinically based and recovery oriented, meaning we have a number of teams. We have 4 different teams that are based in the Boston, Chelsea, East Boston area. And each of the teams is staffed by many different disciplines. So we love social workers. That's who lead our teams. We're mandated to have licensed professionals lead our teams, and we have a program director and an assistant program director who are licensed professionals and can also provide social work supervision to get new graduates going towards getting their LCSWs or ultimately LICSWs licensure. Each team has 4 what we call clinical coordinators, 4 clinicians that lead the rest of the multidisciplinary team. The positions are supposed to be staffed by people who are already licensed, but we have permission to hire new grads, social work grads or LMHC grads. We can hire them as they're working towards their licensure. So we gladly hire new MSW grads to be clinical coordinators on our program. We have, as I said, clinicians. We have a psychiatrist on each team that provides psychiatric consultation, supervision, and guidance around the many kind of concerns that we have with our clients. We have a lot of direct care staff who are oftentimes college graduates who are interested in getting into the field, and they do a lot of outreach with our clients in the community, or they are working in the group homes. We have people helping with housing, because we have many people referred to us who are not housed, and we have ways of getting people subsidies in housing. We help with employment. We help with, we have a nurse on each team, a registered nurse, who also helps figure out how to help people with major medical kinds of concerns in addition to the psychiatric concerns. So most of the clients that we have are diagnosed with something on the schizophrenic spectrum, many people with affective disorders, bipolar disorders, and we have people who are often needing crisis intervention. We provide that, and we have on-call services 24/7 and all those kind of things as well. So we have multidisciplinary teams, and the social worker, if we were to hire someone like yourselves, would be leading the team, would be assessing the people on your caseload for what their needs are, what their risk factors are, would be putting together, with help from other people on the team, a treatment plan and risk plans and crisis prevention plans and things like that. And you'd be working directly with the clients on the team, face to face, either in office space or in the community, whatever the preference is of the particular clients that you might be working with. Right now, our staff are able to work remotely to a certain extent. Usually on most of the teams, people are reporting to work in the office 3 or 4 days a week and working remotely a couple of times a week. But all remote means in this case is that people aren't in the office, but they still have to go meet with people in the community and do whatever needs to be done. And their home is their office for the days they're working remotely. So it's a program where you're going to be working with people face to face and doing what you can to improve their lives. And when I say it's a clinically based program that is recovery oriented, what I mean is we help train our clinicians in evidence-based practices, in things that I'm sure you're probably either trained in or are familiar with over at Simmons, motivational interviewing and other assorted evidence-based trainings. But we care less about what someone's diagnosis is and more about improving the quality of life for the people that we work with. And for us, I think recovery means that people have hope, that people have a role and responsibilities in their life, that people have places to live, or people are in school or working if that's what they want, that they have a purpose in life. And it's not just about dealing with symptoms of whatever someone's particular diagnosis is. So that's a rundown of my program and some of the things that social workers would take part in on the teams that we have here. Do any of you have any questions about what I just described?
Actually, I just want to call out, Peter, that you'll see that there's an array of graduation dates, if you saw those in the chat. So from May of, or from the winter of 2023 through 2025. So people are just coming in early to get a sense of the possibilities.
Okay.
Okay. Also,
So I could say for current students who aren't graduating for a while, we do have a lot of interns. I don't think we have any from Simmons this year. We have a lot of BC students and Leslie students and assorted others, but this year we have 10 interns in the program. So if anyone's interested in this kind of an internship, if that's where your interests lie, we're happy to have interns next year as well.
that's great. That's great. So I want folks to be able to ask their questions, but also want to, I know that you have told us about your program in particular, but anything that you can, if you can give us a broader view of North Suffolk, and if you can, and I think someone has a question, if you can talk about the family and adolescent services, that would be helpful as well.
Okay.
Generally.
North Suffolk's a large agency with, I'm going to say something like 30 or 40 different kinds of programs, some large, some smaller. They have over 1,000 employees spread out all over the place. The ACCS program that I described is the largest program that's working with a DMH clients. There's a large component of North Suffolk also works with DS funded clients and has something like 20 group homes if you're interested in that sort of thing, and higher clinical coordinators and people who are trained in behavioral interventions to help folks who are maybe intellectually impaired or developmentally impaired as well. There's any number of programs having to do with substance use, both in terms of outpatient work, working in 3 different clinics that North Suffolk runs, outpatient psychiatric clinics, some of which specialize in substance use and also provide medication-assisted treatment in addition to outpatient counseling. North Suffolk has programs working with families and kids from literally infancy, early intervention programs. If you're interested in working with little kids and mothers and fathers, mostly mothers, who are having, whose children, I think it's basically age 1 to 6. If you're interested in working with that population, a very established early intervention program to help for people who are looking for help, both voluntarily and people who might be connected because of DCF interventions to help them move along in their lives. There's in-home therapy programs that North Suffolk runs, where you would mostly be working with families and latency age and adult kids in the families, providing, I don't know if you're familiar with this kind of program, working with people mostly in their homes, with kids who have either emotional or psychiatric difficulties. Oftentimes substance use is involved there. And with the areas that we work in, there's a lot of kids who get into trouble on the streets. There's gang activities and things like that. So if that's something you're interested in, there's North Suffolk has a large in-home therapy program that you could, I'm sure they're looking to hire people too. It's not my program, but.
Right. Well, that's very helpful. Terrific. I think someone was just asking about, on the internship side, are there opportunities in the early intervention program for internship?
Yeah, I'm pretty sure the answer is yes, Haley, but I could get that answer for you. Like, I don't know, should I send information to?
Sure, you can send it to me. Sure. And Haley, much of that we'll hear as you meet with your field faculty. If this is a organization of interest, you can also throw it out to the field faculty during that interviewing process in the placement process as well.
I'll get the answer to that and send it to Sandra.
Yeah.
The woman who runs the early intervention programs in LICSW. She's been at it for even longer than me, if that's possible, in this program, and she runs a really well-respected program. So I'll get you that information.
Perfect. So with that, I do want questions. Any other questions from those who are here? That this has been an org of interest. Emma, I saw you come on first. Go for it.
Hi Peter, thank you so much for coming. I am currently interning with a very similar organization that and doing in-home therapy with them. And I guess I'm wondering how are the trainings, and also what is I'm finding there's a lot of turnover in some of the specific areas. And I'm wondering sort of what does the turnover and sort of like employee sort of like what's the employee support look like at North Suffolk?
Well, that's a hard question to answer for other programs that I'm not really part of. In our program, as I mentioned before, it's led by clinicians who understand what it's like to be a young clinician, and have come up through the ropes to lead a team like this. They are very familiar with the stresses that young recent graduates might have and feel in this kind of a position. I think that's really true across the agency. You would be supervised by a social worker. You would also we have any number of other supports that people in our program have, where we have the person who runs our intern program is an LICSW and also provides additional individual and group supervision towards for people who are working towards licensure or LICSW licensure or other kinds of licensure as well. We also have a very experienced LICSW and rehab counselor who used to be a regular employee in my program and has since retired, but he runs support groups for our clinical staff outside of the program, but anyone who works in our program can be in it. More of a, I won't call it group therapy, but it's not just about work, it's about supporting people as they're trying to do their jobs. So there's any number of different avenues that people can get support from. In terms of the other programs, I know the directors of the programs and I know how good they are and how much they care both about the clients and their staff. I can't speak to exactly what their supports are, but I can say that everybody gets supervision, quality supervision.
Yeah, that's great. That's fine. Sometimes we have these chats and sometimes we have the recruiter plus the hiring division or departments, here as well. And so sometimes they can give a broader view of what does retention look like? What does professional development look like? So, but I think you've given a nice understanding, at least of the program supervision, licensing support, etc. They may want to hear a bit about professional development opportunities in your department, and how that is allocated. Is it everybody gets a bit of time to get CEUs, etc.?
Yes, of course. Everybody gets a certain amount of money towards outside trainings. We have a dedicated training center that has different kinds of trainings for all North Suffolk employees, some mandatory trainings, some having to do with getting oriented into a program. But through the course of a year, there's many opportunities to get different kinds of trainings. We're part of this virtual training network called Relias, or it used to be called E-Academy, that has literally hundreds of trainings on different topics, many of which you can get CEUs as you complete them, whether it's during your workday or on your own time. You would have access to it online to access. And any given time in my program, we bring in different kinds of trainers to provide training. So for example, we have regular 3-day intensive trainings in motivational interviewing, since that's so important for us, by a training organization and trainer that just is excellent. Recently, one of the trainers we had come in did a training on trafficking kids and adolescents, and helping them get through that, and working with individuals and families. That was pretty relevant to any number of the clients that we have gotten referred to us. But really, between our program and the agency, there's a lot of trainings being offered, and I think the agency pays a lot of attention to to staff development, and also is very interested in career ladders within the agency. So many of the people who are our program directors in different parts of my program and different parts of the agency have, started out as, a new young graduate from a program like yours. And if, people who liked that kind of work, there's opportunities, to get different kinds of positions, whether it's continuing to work clinically or working more administratively. And as I mentioned, there's also three outpatient clinics that always have the need to hire clinicians to be therapists as well.
That's great. And that was, of course, where we would go around growth opportunities, et cetera. So thank you for telling us about that. And I think maybe to round out, you've been there. You've been there for some time, if I recall from the bio. Tell us, there's a question from Janie, just around how'd you start and what has kept you in chronic mental health as your area of passion?
Mm-hmm. So I graduated Simmons in 1982. So I can't even remember that far back, but I seem to remember that I was always interested in mental health, partly because I had a brother who was diagnosed with paranoid schizophrenia, and I was sort of naturally one of the a family member that, in addition to being a brother, helped with his care over the years as well. So I was sort of preordained to be in this field. I had a field placement at a place that I don't think exists anymore called the Boston Evening Medical Center, where I got a lot of really good training in clinical work and therapy, both individual and group therapy. Let's see, when I graduated, I got a job working with adolescents in a special ed program in Boston. It was run by Bay Cove Human Services, and it worked with kids, adolescents with serious emotional difficulties. And that was probably the most challenging job I ever had. It seemed like everything after that was pretty easy, no matter what I did. So I worked in that program, working with adolescents in a therapeutic kind of day school, and eventually became the clinical director of that program after I'd worked there for, I think, 3 years. And after that, my job travels took me to working in an inpatient unit in a psychiatric hospital. And I was a clinical director in that program, in that hospital that no longer exists, either Malden Hospital. And then at some point, after I took a few years off to be a stay-at-home father with my 3 kids, I went back to work and I've been working at North Suffolk for something like 17 years. First working in a different program that was called supported housing, working with people living in the community, adults who were in need of supports, living in the community, same kind of population. And then as the Department of Mental Health started offering and funding different kinds of programs that work with adults, found my way into the program that preceded the one I work in now. I almost said live in because it seems like I almost live there, and have been working with this population as the director of this kind of program for many, many years at this point. I enjoy doing it. I enjoy mentoring younger people and seeing them develop. And I think this kind of work is extremely challenging in many, many different kinds of ways. You're working with situations and people that present challenges But I could say for sure that, especially for people just getting out of their graduate programs, this is a very good foundation, because if you're interested in mental health and working with adults, working with diagnoses across the psychiatric spectrum and people from 18 to 100, and working in a multidisciplinary team, you'll have such a good foundation working in this type of program after a couple of years that you'll do so well in whatever jobs you take after that, because you're exposed to just about everything you could be exposed to in this sort of position. So I can say that very with a very straight face, because I believe that.
That's great, Peter, because I appreciate your willingness to share your story of how you came to the work, but also it allowed for, I think, the students to hear all the many places, right, that the degree may lend itself, right, from outpatient, community to the inpatient setting, which, I don't know that everybody's thinking that it has that versatility all the time. And so it's great to hear how over the years it can go down many courses. And so just to remain open as you are looking and weaving your way and navigating to the right positions for yourself. Other questions, burning thoughts. You have Peter as captive practitioner and leader, and all the different leadership roles he took on in the journey are really interesting to hear as well. So please, this is your time. What's intriguing you about North Suffolk? What made you come into this chat today? Don't be shy.
Well, while you're thinking, I could also say that in this kind of a job, you'd make a lot of contacts with other people. You'd be working alongside people who work at the Department of Mental Health, people who work in just about every inpatient hospital setting that there is out there, people working with the homeless population in shelters. You would be exposed to and make connections with many people. And another thing about North Suffolk is that the population that we work with is very diverse, and the staff that we have is very diverse. We have in our teams people who are from all over the world, who speak every language you can think of. We have dedicated teams working with our Hispanic clients, with our Vietnamese and Cambodian clients. We have a deaf team working with people in the community, and one of our group homes is for deaf folks who have mental illness, and all of the staff are deaf and or fluent in ASL. So we have the community of people that we work with is very diverse, and our staff is incredibly diverse as well. So if that's something that is of interest, our program would meet those neat kind of preferences for you.
I had a question about sort of re-entering the workforce with an MSW after taking years off to parent. And that is sort of like something that I would see myself doing. And I'm just wondering, what was that experience like, and like how easy, hard, like what questions were you asked? Like what was that like?
I was mainly asked questions by my wife at the time of, what I was going to be doing to get myself back in the workforce, because I really enjoyed being at home. At the time, my wife was the earner in the family, and I liked being with my kids at that point. But looking for work is never fun, and it's a terrible experience until you get the job, and then you kind of forget about it and you just move on with your life. But I knew what I wanted to do, and I knew what my skills were at that point. I already had a lot of experience. It wasn't like I took time off right after I graduated from Simmons. I'd already worked for a while. So I knew what my capabilities were, and I knew where my interests laid, and I just started contacting the contacts I had and got suggestions of where to apply. And I can't remember how long it took me to get the position at North Suffolk at that point, but as soon as I got it, I was on to my work life and no longer worried about what I was gonna do. Again, these days, I don't see things changing in the near future or the not so near future in terms of the job market. Agencies are desperate to hire people. You have your way, basically. If you're a decent candidate, you're gonna get a job. It doesn't matter whether you've been in the workforce or out of the workforce. Every agency across the country, across the state, I can speak of, because I'm in many meetings that I meet with colleagues who are run similar kinds of programs and agencies. And since COVID, everybody's desperate to hire. So it's a buyer's market, and it doesn't matter if you've been out of work for a couple of years.
That's true. Across sectors, yeah, we're definitely knowing that this is a great time to be in social work schools.
And there's there's new programs being that are starting in literally in a few months across the state as well, that have to do with adult services, kids services, emergency services, outpatient clinics. And there's going to be more and more opportunities for all of you in the next couple of years. And, that's not going to be your problem. Your problem is going to be figuring out which of your many offers you're going to accept.
Selecting.
And
Yeah,
people love social workers.
That's great. That's great. I was going to ask, does North Suffolk have crisis? Did you mention crisis and emergency
Yeah.
work? It does, right? It's okay.
Yeah, it's something called the BEST team, Boston Emergency
Right.
Services.
Okay. That's what I thought.
Yeah.
All right.
But, yeah.
Many of my clients have often called the best team and appreciate their services.
That's right.
I was wondering how many, I'm sorry if I'm being specific, but how long did you work in the field before taking off for parenting? And then how long were you parenting for? I know that's really specific and I'm getting.
Let's see. I think I was working in the field for almost 10 years, and I took 3 years off.
And so your licensing aspects were done at that point. So, right. So 3 to 5 in, you had
Right.
that accomplished. So I think that makes a difference, one, in Massachusetts as well. But yeah, I think that was where we can go with that. Other thoughts, questions on that front? Any private practice work while you were in that 3 years, Peter? Did you keep your network? How'd you keep the network for ready?
I never did private practice work.
You didn't. Okay.
That wasn't my thing.
Mm-hmm.
And I, through my previous jobs and many friends who are in the field, I knew who to call.
Yeah. Good. Yeah. And there's always professional associations and, or, sector specific organizations that professional organizations, you're going to start to get. And I think I really appreciate you talking about the collaterals, Peter, because all of those are a part of that network as you start to set yourself in any position. All those suppliers or others, vendors, et cetera, that you work with to support your client are important to build relationship with as well, and understand, where there may be opportunity for yourself as well.
Yeah, I mean, Emma, if you take a few years off,
It'll be
it's not
okay.
the climate's not going to change that much in a few years. It's a buyer's market. I'm not just speaking for my program, but in general,
Agree.
you'll have more offers than you'll know what to do with.
Yeah. Marcia, she has some questions, and you should not feel shy to hesitate. But let me just preface that, Peter, we talked about the programming, the suite. We also have a bunch of certificates that go with our MSW program now. And so healthcare certificate happens to be one, and Marcia can talk about that in a bit. We have like a school licensure, we have a trauma certificate, which just allows for students to get like a deeper dive within their certificate in 4 courses, basically 2 electives that are specific and 2 core courses. So with that, Marcia is here as a healthcare certificate MSW student. Feel free, Marcia. I think she's trying to unmute herself, maybe. Yes. And you can't unmute yourself? Oh, okay. She didn't want to unmute. She just wanted to make sure that you understood why she was here today. It was because, one, she's in the certificate. She comes from a healthcare background. I want to remember dental hygienist, dental work from Brazil. Okay, phew. And did that for many years. So she has been here. She does medical interpretation and is very much interested in mental health of patients and just really learning the different possibilities that social work plus her healthcare past, where those come together. Our ballot measure will tell you that they will come together, medical, mental, or medical, behavioral, and dental will soonly and surely all come together as a true integrated health. So she just wanted you to know why she came today.
Okay, thank you. I know we don't have dentist opportunities in my agency.
No dental, huh? No dental. I think Haley, is a MSW SEC. We have hundreds and I'm trying to remember, but I get to know folks individually over time. And so we have someone in that program as well. She's in a class. Yeah. She's a dentist from Brazil. That's right. That's right. Well, you never know. Social work. We have social work internships at Tufts Dental in the dental school, and there's that whole marriage coming together. So it's not so cuckoo to say that at some point we will see how social work lends itself to the dental sector as well. So it
Okay.
Other.
I do have other questions, but I'm also very aware that I've been asking a lot of questions, so I want to.
Stacy, Haley, anything that's burning, do not be shy. Go for it.
Peter, I don't know if this is a slightly silly question, but are the employees unionized? Is there a salary ladder? Is it like one-on-one negotiation? How does that?
There's a union that covers some positions. The only position it covers in my program are the registered nurses. But none of the other staff are in a union in my program. In some of the other North Suffolk programs, some more of the staff are in the SEIU. Service Workers Union. And some of the clinicians are in those other programs as well, but not in my program. There's, I mean, every position has a different salary associated with it. There's a step scale depending on, based on experience. At any given time, there might be hiring bonuses. Generally speaking, it's not, you wouldn't be in my program, you couldn't negotiate a salary. It would be what it is, and you would either take it or not take it.
Okay, that is useful.
Yeah.
I'm also in the SAC program, so student adjustment counselor. And I heard that you went from working with adolescents to working with adults, and I'm wondering what inspired that change.
Well, I mentioned that I had personal interest in working with adults and working with people with serious mental illness. My memory is that after a number of years working with adolescents, I was kind of burnt out there and was looking to switch gears at the time. And the people who hired me at the inpatient adult psychiatric hospital took a chance on me because I didn't have any formal employment experience with that population, but I found that, and I think they found that the skills that I had transferred very nicely. I had education, I understood, I knew psychiatry and diagnoses and things like that. It was just a matter of getting my feet wet in a different kind of position, but the skills are transferable. I mean, in the same way that I said that I thought the work in my program is a great foundation for future work. I think the work that I had working with and the challenges I had working with adolescents and families were a good foundation in my case for me to do other things as well.
Great.
Makes a lot of sense.
Yeah. You're gaining skills that can go in and out of populations, in and out of settings. It's really in and out of acuity. It's all about, each person will make the choice that really suits who they are and what their purpose or their calling is to do. So, but it's versatile. It is a versatile path, and it's for you to hone in on what's comfortable for you. We're almost at the time that we told you, about a minute away. I want to make sure that, let's see, okay, Haley, there's no additional questions or from anyone else, Marcia, and I'm hoping that we haven't scared Peter away. He said this was his first doing one of our employer chats. We hope that you will come back in the future, bring people from your team if you'd like. Or from other areas of the organization, so that we can hear more about North Suffolk. And we really appreciate you giving a fuller lens to who North Suffolk is, and that's really what the intent behind these employer chats are. So we thank you and value your time tonight in doing this.
Thank you. I enjoy meeting with people who, I was in your shoes many years ago. It brings back some memories. So I know I'm going to look into the question of the MSW interns in early intervention. Was there any other homework I have for you at the moment?
None from that I wrote down other than that. And I will send that over. Once I receive it, I'll send it over to our field education department with Eugenia Knight. So our on-ground folks. So that's perfect. And we've been in email chain, so you know how to connect with me. I appreciate everyone's interest and the questions, and thank you for coming in. And I know that some are in transition and will be off to their 6 o'clock. Keep coming, and we're next time. I don't remember who's up next, but there'll be someone else. And Stephanie should not be quiet in these sessions either. She is the engine that keeps all of these happening with the employers. And
Yeah.
so we're hoping to see, I think, maybe North Suffolk at the employer
I think it's BMC next.
here. BMC's next,
BMC
but we'll,
next.
that's right. And then as we go into the new year, there's a job fair, the traditional annual job fair, and many of these employers, you will get to see them when we're going back live is the goal. So you'll get to see them there, and it'll feel different because now you have a connection with someone within the organization that may or may be a part of that.
Right.
Anything
I'll send Sandra my email address if people have other questions that they
Please do.
have or interested in other programs. Feel free to email me and I'll do my best to get back to you.
That's great. We appreciate that. Thank you so
Peter.
much. I will also let alumni know that you did this and they like to keep track as well, if that's okay with you. That's the other side of my my responsibilities, is I'm the liaison with the alumni force, the alumni advancement area of the university for School of Social Work. So we love to keep track of those who have taken time to give back to us in this way. So we appreciate you. Okay.
Thanks.
Thank you.
Thank you.
See ya. Bye.
Very good. Thank you. Bye-bye.